Hi, everyone. Thank you so much for joining us. I am Ashley Reid, the CEO and founder of Wellist. Many of you might be very curious about why we're talking about employee well-being, given that the bulk of the last decade we've spent helping health systems navigate their patients. But over the course of the pandemic, as you might imagine, all of the frontline care teams were really struggling with how they were managing their own childcare and emotional support and drugs delivered to their parents. And so over the last year, our business has really spent a lot of time looking at what is the state of employee well-being, both for our provider clients, but also outside of healthcare. And I am joined today by some of my favorite people who have really helped us get a better understanding of what some of the challenges are and how urgent this employee well-being crisis is. And so I want to first sort of introduce the panel and let them tell you a little bit about themselves and their organizations. And the goal of today's discussion is to really better understand what are the opportunities to improve employee well-being and equity in a way that drives business performance in 2023. So thanks so much for joining us. To my left, although I know that this assembly will be different for everyone, is Orriel Richardson, who joins us from Morgan Health. Andrea Alexander, the Chief People Officer of Runway and practice expert and Associate Principal at McKinsey, Bonnie Dowling. So ladies, thanks for joining us. Orriel, I'll let you lead us off on telling us a little bit more about you and your role at Morgan Health.
So good afternoon from the East Coast to everyone. I'm very happy to be here with this group of ladies, and I'm very happy to give you a little bit of my origin story into how I came to do the work that I do for Morgan Health. So I am a healthcare lawyer by training, and my career has really covered local, state, and federal government policies, particularly in the Medicare, Medicaid, and marketplace spaces. But thinking about the 150 million Americans who rely on their employers for their health insurance coverage, and also being one who is super curious and wants to understand all aspects of things that I set out to try to impact, it was important to me to take a leap into an opportunity that would give me the chance to really drill down into the space of employer-sponsored insurance. And so when the CEO of JP Morgan Chase decided that he wanted to continue the bank's work in healthcare after Haven Sunset, which was a joint venture with Berkshire Hathaway and Amazon and JP Morgan Chase, our CEO, Dan Mendelsohn, came on board and launched Morgan Health in May of 2021. So Morgan Health is a business unit of the bank that is designed to change the way that employer-sponsored insurance operates to the betterment of affordability, quality, and equity of the coverage in employer-sponsored spaces. We work closely with our benefits team on the corporate side, and also strategic investments, where we've deployed 105 million of a 250 million pot of capital to solutions that are focused on our mission. And then we also have a health equity and a policy component, and that's where I sit. So happy to talk more about that as we continue the conversation.
Andrea, do you want to go next?
Yeah, sure. So super happy to be here and be part of this panel. My name is Andrea Alexander, Chief People Officer at Runway. If you're not familiar with Runway, you should. But it's basically a organization that creates a closet in the cloud for women. And so you are able to rent clothes instead of buying clothes, which is better for the environment and allows you a lot more optionality in terms of your own wardrobe. As a Chief People Officer, I am responsible for everything people related. So this is from attraction and getting people excited about wanting to join Runway when they're with us, their development, their career growth, the benefits that they have, compensation, and then when they are thinking about leaving, even also staying in touch with them and making sure that they become boomerangs and come back to Runway. We have a global workforce, so in Galway and in the US, and our workforce is also split between corporate and then hourly associates in the warehouse, as well as CX agents.
Thanks for joining us. Bonnie.
I'm Bonnie Dowling, and I am joining you all from Colorado. It's sunny but cold here today. and I am with McKinsey, and I've been leading our firm's thinking around hybrid virtual working and the great attrition, great resignation. Ultimately, what it comes together as is workforce effectiveness and the next normal. And to give you a little bit of background on why I'm doing that and why it interests me. I was actually a nurse before I joined the firm. And so I got involved early on into the pandemic and helping clients think about what was this going to look like? How could they keep their employees safe? I actually did that with Andrea Alexander when she used to work for the firm. And then through that, one of the things that I started realizing was this has fundamentally changed the contract between employees and employers in terms of what employees are asking for. But it's done so at a time when people are exhausted, when we've had crises after crises pile on top of each other, and people are burned out. So there's a mental health aspect to all of this as well. And we have started to see that over the past year and a half manifest itself, or 2 years even, in the rising rates of attrition. And so how do we actually take a holistic approach to creating something different that can actually make work for our employees, for our organizations, and for our customers as well?
Thanks, you're the best. So, Andrea, we're going to talk about the state of the state and what's going on the ground. So we're going to start with you because I think it's really interesting to be managing both corporate employees and then teams in warehouses or in call centers. So I'd love to just sort of have you lead us off on like, what are you seeing today? What are the challenges that people are struggling with? And how are you thinking about addressing those at this point?
Yeah, so first I will say the pandemic impacted everyone, and we are still in the middle of the pandemic, I guess, or at the end of it, and we're still realizing the effects. The one topic that continues to come up across the board is about well-being. What are we doing to support our employees and make sure that they have the mental space to be able to take time for themselves and make sure that they're taking care of themselves, but also make sure that they have the resources at their fingertips to support themselves and their families. And one of the challenges that I have in my role is making sure that we are meeting all of employees' needs, and the needs often differ given the different parts of the organization that they are in. So our corporate employees, well-being is a very important topic. It's one that they bring up. I often get emails from employees about, have we thought about this benefit or that benefit? And I'm always considering them and thinking about how we can enhance them. Something new that we've added is a benefit where all of our employees have access to mental health professionals, where they're able to call them at any time of night, day or night, and talk to someone immediately to help them process whatever they're going through. And that's something that's been really effective with that population. In the warehouses, we have similar challenges around well-being, but there's also just a simple challenge around they need to be in the office or their office, which is the warehouse, on a daily basis to do the work. We are not able to deliver product to clients, our shipments to clients, if they don't show up. And so it's harder for them to go to the doctor. It's not like they can work from home for a day and then during their lunch break, go see their dentist, right? And so what we've had to do in the warehouse is what we've chosen to do is actually bring doctors to them. So every month or every 2 months, we have doctors that show up that people can make appointments with, ask questions so that they can, obviously it's not the dentist, right? So it's general doctors that can then kind of answer the first level questions and tell you whether you need to go to a specialist. And so that's been really effective for that group. And we always see a lot of people attending those sessions. With our warehouse employees, we also have multiple languages. So other than English, we have a lot of Spanish speakers, Vietnamese, and Arabic. And so we've had to be really thoughtful about how do we make sure that they're also getting the information that they need. But across the board right now, I would say well-being, mental well-being, and then also just access to doctors and the information that you need, and being able to get that without missing a lot of work, which will impact the amount that people are able to take home.
Orriel, how is that similar or different than what you guys see at JP Morgan?
I mean, I think one of the things that Andrea touched on is sort of there isn't necessarily a one size fits all approach if you have employees across different sort of occupational classifications. So in the context of the bank, you think financial institution, you think Wall Street, you think, affluence for the most part. But we also, operate branches around the country. We have call centers around the country, and those are different types of workers. We have, of course, a really robust technical support team, and those are also sort of sedentary in the office sorts of jobs. And I think, the co-locating doctors periodically, that's a great sort of way to make sure that people who have to show up in the office or in the warehouse have access. And I think it's similar to the approach that we're piloting in Columbus, Ohio, where we've partnered with one of our portfolio companies, PreHealth, which is a combination of Vera and Castlight, to work in the city of Columbus, co-locating 3 to 5 clinics near our employees' sort of workplace. And this is supplementing the sort of traditional clinic that you have as an employer, like JP Morgan, where they can go and get some vaccines, some basic sort of like, I felt ill on the job, sort of like see the work version of a school nurse in a sense. And sort of having that near site is the same concept of people don't have time to take off and take care of their families. And, I always say doctors like to have a 9-to-5 work schedule as well, right? So we're trying to get our employees in a space where they are comfortable and have time and don't feel subtracted from in terms of their day and their time, which is, one of the things that we cannot regenerate or create more of when they go to take care of their health. And overall, I think the concept of well-being is not just important for employees to actually show up and be willing and able to perform, but it's also generally an important part of this sort of generational shift. And when you consider what it's going to take to retain, some of the talent, these things are top of mind for some of the younger generations as we start to see that shift and concentration of which generation is mostly in the workforce. So those are, very key issues. COVID has certainly changed the landscape of everything. You could talk about in-office workers and hybrid work, which I'm sure Bonnie knows all about, and we'll talk about some, but also even the concept of valuing more those workers who are wage workers and have a different sort of classification, but recognizing if they all rely on employers for health insurance and health coverage and sort of EAP type services, we have as employers an obligation to meet them where they're asking us.
Yeah. So I think you both brought up 2 really important things: segmentation by job class, right? And even age or like generational disparities. Bon, you've done a lot of work on attrition and even behavioral segmentation. So what have you learned sort of looking how different groups are struggling, and what are some of the things that we should learn as we think about tackling these challenges?
Yeah, I mean, look, I think that there's certainly different things that we need at different stages in our life, but a lot of that comes down to some of the same fundamental desires, right? Around autonomy of our work. We want to be trusted. We want flexibility. We want to be able to address our needs outside of the workplace, like as well. But that doesn't necessarily mean a location of work to the hybrid virtual piece. That can be a lot of different ways to look at that. But things like the ability to address your health. So I love what Runway is doing in terms of bringing doctors on site. I think that's awesome. When we segmented out employees in one of our surveys that we did earlier this year in April, one of the top things that people identified as being a factor that would bring them back into the traditional workforce. So as you as an employer are thinking about how do we actually get more people, one of the top things was actually support for health and well-being. So how do you do that as an employer? Yes, there is the element of, well, we provide good benefits. But if your employees can't access those benefits because of the hours that they work, that's not that helpful. And if you're like, well, but they have flexibility because our office workers are all working virtually, so they can go whenever. That's not true for half the people. I mean, probably more than half have spent 15 hours a day and in front of a video conference screen, right? Like, you don't have the flexibility to go to a doctor then. On top of that, it's only about 50% of Americans have access to affordable and reliable childcare. So if you're asking them to do things, to take care of their things outside of the work hours, then you're putting even more burdens on the childcare element as well. So how do you start to think about what are the right benefits that are going to help address not just the things that they're doing at work, but how are you going to take some of that burden and the burnout out of home as well?
Yeah.
And so I love being able to do things while you're at work is great. One quick example, it's not a mental health, but I think it takes some of that load off. I had a client, we're in the Rocky Mountains, we have to change our tires twice a year. It's a thing, we just have to do it, right? You'll slip and slide if you don't. So you go and get your studded tires. It takes a Saturday morning. You make an appointment, they are not ready when you come. And so instead of being an hour of your Saturday morning, it is 2 to 4 hours of your Saturday morning. It is frustrating. They got an agreement with some tire places around the city, and you signed up for a time and you left your keys, and they came and picked them up and changed your tires. The employees actually still paid to have their tires changed. It wasn't something that the employer paid for, but it gave them back a Saturday morning. That gives them back time to relax. That allows you to feel more rejuvenated when you return to work. So thinking sort of outside of that box about how you can help with the benefits that go beyond just health insurance, I think is also really important.
Yeah, this was something that was one of the biggest learnings for me as we entered the employer space, was that, we are navigating employers back to the benefits that are already existing, plus things in their community, as you described, that they pay for. The most frequently sought after services were things like grocery delivery, home cleaning, errands and tasks, pet care. And it really is reinforcing what you guys are saying about time being a scarce resource, especially post-pandemic, when we have such pressure on personal performance and mental health. So with that, I think we've really sort of started to get into this discussion around why now. But I think the other thing that we're running into post-pandemic is this like unique, financially vulnerable moment for organizations running their businesses. And so, Andrea, how are you thinking about these challenges really limiting your ability to grow profitably, and what are you doing to address them?
Yeah, so we're thinking about them every day. I would say, as an executive team, the most important thing to us right now is to grow, right? As I think it is for many companies. And in order to do that, we need to reliably deliver shipments of rented clothes to our customers. That's what we need to do. And in order to do that, yes, we have to have the corporate population of engineers and tech individuals that are building the actual websites that allow us to have the technology to be able to deliver on this. But we also have to have the people show up to the warehouse on a day-to-day basis, clean the clothes, put the clothes away, pack them into the new bag, put the shipping label on it, and actually get it out the door. And when those individuals don't show up, we would miss our guaranteed shipment times. And it's immediate impact to the customer. And so when we think about what benefits should we provide, how much should we invest in that, that is part of the calculus or the decision that goes into it of we have to invest. Choosing not to invest is actually going to cost us more money in the long run. And so it's really making a longer term decision on this. I will say we are doing our best. We continue to improve every day. We don't have all the answers. The topic that Bonnie brought up in terms of childcare is very challenging for our corporate population and our warehouse population. We have not solved that yet. And it is top of mind, but we're doing what we can. And I want more examples like the tires of things that that don't come to mind immediately, right? That will really give people time.
Yeah, I love Bonnie's example as well, because the other thing that showed up in our data that was surprising to me is if you give people choice, so you take childcare, right? A corporate benefit versus something local in your community, only 15% of the time are your employees going to choose what is free for them, right? Overwhelmingly, they're going to pick something that they have to pay for, regardless of job class, right? They just don't have the time to go out and find it. And so your point there is really, really well taken. So Bon, I'm going to throw it back to you. You've done a lot of work trying to size what's the economic impact of this problem. Can you tell us a little bit about how you think about it now and how that's changing sort of in 2023 versus what it was, we'll say, the early days of the pandemic?
I mean, look, if we know that if you are burned out, if you are having, mental health challenges, not even to the point of saying it's like full on anxiety or depression or any of that, but just you're burned out. And we know that, it's over 40% of women are saying that they are frequently experiencing the signs and symptoms of burnout on a daily basis. If you're experiencing that, you are 1.6 times more likely to consider leaving your job, as well as to actually leave it. So when we look at this whole great attrition, great resignation, tsunami of turnover, there's a very real driver of it, right? There's a lot happening, but we can't ignore the well-being and the mental health aspect that's behind so much of it. And to put that into a little bit of perspective, in the US alone, since the start of 21, over 80 million people have quit their jobs. That is more than 50% of the entire full-time employed workforce of the US have quit their jobs in the past 2 years. That is a $2.5 trillion problem for US employers. And so now when we start to talk about, hey, well, like, we don't think people have been as productive because we're seeing these different kinds of losses, et cetera. Well, many organizations have been running under, so they don't have they're not at full capacity in terms of the employees they need. So no, they're probably not producing at the same level that they would be if they were fully, if they're at full capacity for their employees. Beyond that, their employees they do have are burned out, so they're probably not functioning at their highest. Then you're hiring new people, which you then, by the way, is taking more energy and time and effort from your current employees because they have to train them up. And they're not productive yet, as they wouldn't be because they're new hires. And then they're leaving, which is causing more burnout, right? So there's all of these contributing factors that, well, of course, we're not as productive as we were before when we were fully employed and we were not burned out. So, the attrition itself, $2.5 trillion, but it's continuing to compound on top of that.
Yeah, I really appreciate that. And both in attrition and then these unplanned absences, right, that we do. I think that's one level of sort of economic cost. Orriel, when we were talking in the pre-call, you really did a nice job of highlighting, and it sort of came up earlier in this discussion. There's also healthcare costs, like direct costs of healthcare tied to this problem. And I know JP Morgan and Morgan Health did a study on this, so would love to hear a little bit about what you learned.
Yeah, so I guess before I talk a little bit about the study that we did, I'll kind of tee up health inequity broadly. So, usually, and I think most of the research that we're able to rely upon looks at health inequity as a byproduct of racial and ethnic sort of discrimination and such. But there's also, of course, to be considered income difference, pay tier differences. You have to consider geographic differences and those sorts of things. But in the context of what we know now and how we currently look at the problem, it costs annually about $320 billion to not do something about health inequity. And if you continue to see this unchecked or unaddressed, you're talking that it will, itself be a $1 trillion problem over the next 15 years. And so you look at that and you see, employers grapple with growing healthcare costs, growing attrition concerns, the need to retain and be competitive in terms of the benefits packages offered. And you just consider, okay, well, where are the disparities? Where are the issues in the employer-sponsored arena? There wasn't any baseline sort of data for us to rely upon when we started embarking upon this question. So Morgan Health engaged NORC out of the University of Chicago to establish generally a baseline study of inequity within the employer-sponsored arena. And what we found, contrary to many CEOs, our CEO often says that CEOs tend to think that inequity is a Medicaid problem, but this study emphatically shows that that is not the case. By race, ethnicity, you see disparities across chronic disease burdens. You see disparities, particularly in the cesarean section rate between Black women and white women. You see significantly concerning disparities in terms of mental and behavioral health concerns with our LGBTQ community, and substance use disparities, interestingly, are the only place where it's flipped, where the disparity is showing a greater disadvantage of white employees versus employees who are people of color. So, that sort of study is the first, it's kind of, our first foray using publicly available data sources. And it gave us the sort of business case to start embarking upon more of an analysis within our own employee population, because we want to impact employer-sponsored insurance broadly, but we want to be, sort of like a believer of our own profiting, right? If we're going to be a prophet about these approaches, we want to understand and deploy meaningful interventions and pilots within our own employee population. And so that's one of the sort of things that we're starting to use to govern, like, what types of partners are we looking for? What types of strategic investments are we prioritizing? What types of pilots are really going to be able to make the biggest impact in our employee population? And like, I guess one of the issues, to kind of go back to something that Bonnie said with regard to childcare, and to then also go back to something I said with the new sort of changing of the guard and generations in the workforce, it's not just caregiving for children. It's caregiving for adults and parents, like, who have needs. And the fact that at least on the child side, you have education, you have school, you have some sort of infrastructure in place to where there's a supplement that needs to happen on the side of what most employees need with childcare. But on the side of employees, particularly once they pass that socioeconomic level where their loved one, their parent, can qualify for Medicaid, there is no long-term care support. There is no sort of like synergized place where employees can say, great, I can go tap into this and find a caregiver for my adult parent or my adult sibling or my adult child who may have special needs and continues to live in the household. And so these sorts of things are top of mind. The caregiving piece is one of my soapbox issues, because no one has tried to really solve it in the context of adults. And it is literally looming as we see the Medicaid rolls, and the Medicare rolls anticipated to go to 80 million in the next 10 years. And baby boomers are getting older, and we have more adults who have special needs and need care. So the sort of business case that we've been showing is it costs in the healthcare sense not to address inequity. And if you don't address inequity, you're going to only see what we know now: our runaway healthcare costs continue to go up.
I really appreciate you bringing that up, because when we're moving in, you have mature players like Bright Horizons and Care.com and Sitter City that end up being the one size fits all corporate benefit. But when we go into the nuances of what people need, because as you described, they have special needs children, or they need backup childcare, or they need respite care, or they need an after school program. Like, the breadth of resources that exist in the community, I think, is what we're increasingly compelled is probably a better fit for diverse populations, given that, there isn't really a one size fits all approach. And even if you get a discount for one of these large providers, it doesn't always meet the needs of all of your employees. And so, Andrea, you spent earlier about like there are lots of needs, there are lots of solutions. How do you get your head around what to do, how to do it? Tell us more about the processes and what you would love, if you could get it sort of going into the next year.
Yeah, I mean, I feel like a lot of time and effort and energy goes into doing our best to understand our options, what others have done, thinking critically on our own to understand what we can do that's new and innovative and different. And you make progress every year, and you still have more to do. Some of the biggest challenges, and I'll just kind of recap them, is first, for us, language, because even if there is a benefit that is provided, how do we make sure that everyone truly understands that the benefit exists? And we have a pretty large Spanish-speaking population that's also encompasses managers. And so with our Spanish-speaking population, it's actually been a bit easier, but we are still really struggling with the Vietnamese and Arabic and the other languages that aren't where we don't have as large representation, because they're amazing workers. They're supporting us so much in terms of getting these shipments out the door, but we sometimes have to actually ask them to call a child or a spouse who can translate for us. That happens often. And so I'd say that's one of the biggest challenges that we have. For our, I can't tell if you wanted to say something there, but for our warehouse population in particular, the access and making sure that people have time to take care of themselves and their families is important. Obviously, we have systems in place that allows them to take time off, but sometimes it's not enough for some people. And so figuring out how to better support them and bring more resources to them so that there's less to do at home is something that's critical. The bringing doctors on site is one of the solutions that we've had there. And we're always trying to figure out, obviously, other things that we can do. When people were getting the COVID vaccine, we brought them on site, right? So just flu shots, it's good to bring those on site. Things like that help so that it's one less thing to do at home. But there's still more, I'm sure, that we can do there as well. And then across the board, I would say just reminding people of the resources that we have. I can't tell you the number of times that our corporate population reaches out and says, I wish I had access to someone to talk to about this topic, even finances, right? And I'm like, we do, we have that benefit, right? And it's like, oh, we do? Oh, okay, great. And we have so many benefits that actually on an annual basis, we look and we see how many people are using the benefits that we have. And so I literally just earlier today was talking to one of my teammates who leads benefits for Rent the Runway. And we were going through numbers of usage rates of a service that's actually going to be up for renewal in March. And 30 people used it over the course of the year. I won't say what that benefit was. It's a great benefit, but for what we're paying for it, it doesn't make sense to keep it for 30 people. Now, is it the wrong benefit? Maybe, or is it that people didn't even realize that we had it? And so the communication around all of this is also really important. So lots of things there. I could keep going on, but I want to make sure others can engage with some of these topics too.
So Ariel, please, Bond, go.
I was just going to pile on to that, but in that realm of what can you take off people's plates? I bet the vast majority of folks listening in to this panel, their organizations offer a gym membership or some sort of subsidy for gyms. That is incredibly common at this point. I've worked with a variety of clients that have looked at that and done analysis and said, well, it's really our young men that are using that benefit at the end of the day. And that's great. And we love our young guys, but we have a very diverse workforce and it's not all men. And so what could we do here that would be more appealing and would provide, because there's great benefits, right, of having a gym membership. What could we do that could also provide some of those great benefits to more of our employees? And so the idea of things like subsidizing house cleaning, that unpaid work. So no, it's not the work you're doing for your employer, but it is also not the things that you do that make you feel refreshed and come back to work with your whole self. So can employers start to think about diversifying their benefits to offer some of those? I think is a big space and opportunity too. And by the way, if my employer paid for my house cleaning, I can guarantee you I would never think about leaving because I hate scrubbing toilets.
I agree. So now I'm like, okay, paid house cleaning. That's good to think about. Hadn't thought about that yet.
It's the number 2 most sought after category, right? And the other thing is, we talked about caregiving, right? Orriel, you did a nice job. And part of it's just, aging. A lot of these get exacerbated around specific clinical conditions. I assure you that some of your employees right now and colleagues are managing parents with cancer. Mm-hmm. And I can also assure you that most of them don't know that there are organizations that will come in and clean their parents' spouse's house for free, regardless of income eligibility, and no one knows that exists, right? So Orriel, your comment about how do we bridge that gap of needs to services, whether those services are in the benefit portfolio that only 30 people use, or can we market the gym membership to me so that I use it and take advantage of it, or things that are down the street that I don't know. I think there's a real opportunity. And this is the thing that I think was the biggest piece that sort of compelled Wellist to sort of think about expanding into this space, coupled by the fact that there was very limited data, right? Very limited data around what people really want, need, and use. So Orriel, you're making investments in this space. How do you think about making recommendations on where there are greatest impacts, and what are you looking for today as you're thinking about helping not just Morgan Health build great companies that will solve these problems, but also really hopefully drive real human value to the people who are JP Morgan?
I think, one of the challenging things when you talk about health equity is the sort of phase of the companies or the solutions that are trying to do this. And so in the concept of where we are with our strategic investments portfolio, like it's probably just outpacing the place where these companies are actually like in their raise or in their development cycle. Like, you want a bigger check, you have to have a bigger, like, pool of results and evidence base to justify. And so part of what the team is grappling with now is basically layering and the concept of how do we think through the different ways you can impact health equity. You can impact health equity from sort of a systems approach, like the benefits thing. How do people actually navigate and understand, and are they literate in benefits, lingo, not just health literacy, but even how to navigate benefits such that they can maximize their uptake? Or is there something that we can add to empower the individual in the space of healthcare? Like, do they, understand chronic diseases? Do they understand basic nutrition? Or something that is targeted towards one of the conditions where we see the largest disparities among the racial and ethnic groups in our employee population. So I think, regardless of what those things are, if you have, all of this great fancy benefits, design and no one uses it, it really means nothing. And I often think about the streetcar that's in Washington, D.C. along one of the major thoroughfares. All this money spent, it was supposed to bring equity, connect the city, lots of like delays and getting it up and running. And now it literally just shuttles up and down the street pretty much empty. And I think that is sort of the analogy in my mind about like, yes, it's needed. Yes, it's helpful. Yes, it's comfortable and et cetera, but people do not use it, and why? And so, in the concept of like the things that Wellist is working to bring to the employer space, really understanding, like Andrea said, this 30 employee benefit that we're doing, what is the ROI? Is it really such that we can't find something to supplement it? Could we add something that, is just informational and meet the same need of our employees versus incorporating it into our overall structure? And I really just can't overstate what I think is the need for people to have an understanding of how to navigate their benefits. And that's across pay tier and job classification. If it is obtuse and it's hard and it's difficult to understand and it requires all these clicks to all these external sites and there isn't one place where people can understand it, you're really not doing the work of your benefits design team any services, nor are you doing any service to your employees. And so we're in an era where tech and all of these sorts of solutions are available. And so those are the things that I really look for. And you've heard me question and ask some hard questions. And I'm that person with everyone, particularly in the space of how is this exacerbating, or how have you ignored equity, or how does this, deployed to really mitigate some of the things that structurally, individually, or otherwise contribute to health inequities.
Now, Orriel, something you just said made me think about just the power of word of mouth, where I think if you start with ensuring that some people are understanding all the benefits, it spreads. Like I remember Bonnie and I obviously both used to work at McKinsey, and there were a couple benefits at McKinsey that I don't even remember reading anything about them, but you heard everybody talk about that benefit and you're like, oh wait, where did you go? What was the doctor? Right. And it just kind of spread through the company. And so it's like, how do you create that word of mouth about these great benefits that we have to enhance the usage? Because I think as soon as you get enough people using it, it'll spread even more, assuming it's the right benefit, obviously.
I mean, you're so spot on. The thing that comes to mind as someone who's not a parent is everyone is very excited that JP Morgan offers a SNU as part of its new baby. And
Yeah.
apparently it's very fancy, it's not, you don't get to keep it, but you have access to it. People are like, this is a game changer. And they're very excited. And like, I had no idea what it was. People were talking and I was like, what is this? And literally there are people who are having children on our team and they're all like very excited about that benefit. So you're absolutely right. And it's the sort of thing where it's fancy. Most people, even at the bank, wouldn't necessarily make that investment, but it does help to improve their quality of life during a very trying transition. So word of mouth is absolutely something that's important.
Yeah. And I think when we talk about equity, word of mouth is a unique challenge here. So we have one client, not the slew, but the breast pump, right? In their EAP, there was a breast pump. They could access it also through a homegrown program, as well as something in Anthem. There were 3 ways these employees could have accessed a breast pump. And if you were a mom in a corporate job, someone might have whispered to you that there's a way to get it. But I assure you, the people cleaning the floors had no idea that this was something that was available to them, right? And so the ability to democratize access to those resources, I think, is really important. And also, Andrea, as you alluded to, many of them already exist. They're there, right? Like, so it's not about spending more money to solve these problems so much as it is about making people easily connect to the things that they may or may not know are tailored to their unique needs. Also, as we know, family building is different. If you're a same-sex couple thinking about adoption, it's different than surrogacy. It's different than a 42-year-old female thinking about freezing her eggs. And so this idea about how do we personalize that navigation so that I get the right things for me at the right time, I think, is the thing that really stood out. The only thing to reinforce, Orriel, what you had said was a study that came across my desk that was 90% of employees say they don't have a single place to access all of these resources. So as a result, less than 25% value the investments and the benefits that these employers have made on their behalf. And like about 26% use those things, right? It's your 30-person problem. And so as we're learning more and more, I think that's really the opportunity that we're really compelled by. Bonnie, you've been advising partners around how to tackle these challenges now through a uniquely interesting moment in time. Like, what are you advising now? And also, what are some of the creative or interesting things that you're seeing your clients do that might be worth sharing with other organizations looking to tackle these challenges?
And one of the first things is listening to your employees. Like, many of our leaders came from a top-down management style where they would make decisions, in a back room based on what they believed their employees needed and wanted, push it down, maybe communicate it well, maybe not. That's not the reality anymore. Whether or not it has changed because of generational reasons or it has changed because of the pandemic, I don't think it matters. It's just not the reality we live in. Employees want to have a say, they want their voices to be heard, and they want to be listened to. So how are you talking to them? I was speaking at a conference of auto executives. So it's all of these like people in the automobile industry. And they were doing these like real-time pulse surveys during it. And there was one that was asking how many people drove EVs. And I'm talking like 95% of the people raised their hands. I mean, everybody was driving EVs. Great, that's wonderful for the environment, super excited. Before I started talking, they asked the question of how many people have surveyed or reached out, truly listened to, ask the questions to their employees of what they need and want. And I'm talking like 2 or 3 people raised their hands. I mean, it was like nothing. So more people drove electric vehicles, which may be the end of their industry, certainly a change in their industry, than were actually listening to their employees. That's ridiculous. Your employees know what they need, and they are willing to share if you're willing to listen. So reverse town halls, pulse checks, skip level calling. There's a lot of ways to do this, but you need to get out there. You need to listen to what they want, and then you need to act on it.
Yeah, I mean, listening to employees, like I would echo that a million times over, and people are always excited to give you more ideas. We do a lot of focus groups at Rent the Runway to understand what benefits people want. And I will say sometimes I'm sitting in those focus groups or I get the download afterwards and you're like, we can't afford that. We can't afford that. But it's good to listen to it and say, what can we do? Right. And I also just during this call or this panel was thinking, we also need to think about asking different questions, because the wheel example where you're getting your wheels kind of replaced while you're at work, the questions that I'm asking right now in the focus groups, I don't think that would come up. Right. And so it's like, how are you, we know time is a precious resource. How are you using your time? Like, what do you do outside of work that you would prefer not to have to do? Clean my house, change my tires, you know, but go to the grocery store. Like, these are things that, so it's listening to employees, but also making sure that we're asking the right questions. And this is actually a reminder to me to say, I need to ask more different questions than I am today.
And also the thing we're learning is, can you connect them without having to pay for it, right?
Yeah.
Like, can you solve the problem without, does that financial barrier have to be a fixed constraint, or are there ways to be able to make that bridge?
And I'll give one example of where we actually have been able to do that. So we are a hybrid corporate workforce where we go into the office 2 days a week, and the other days you can work from wherever you want. And when you're in the office, what we I don't even know that we heard this or we just anticipated it, was lunch, like getting lunch. And so what we actually have done is we've set up a Sweet Green outpost where we don't pay for it, right? We don't pay Sweet Green, but you can go online, order your salad, and they will come and deliver it, and they have a place to deliver all the salads. And so that's a benefit that our employees really appreciate, especially when the salads come on time. That we don't have to pay for, but we've set it up. And so doing more of that, I think, is what's helpful.
Yeah. You were talking earlier about clinical access, and what was coming to mind was like the Virtue Dents and the 20/20 on-sites, the ones that come up in mobile eye care, and like, you're not paying for that, but it really is bridging that sort of employee need versus having it either be a personal or work disruption. So
even on-site childcare is like that, right? Like,
yeah.
people think of it as this massive expense that the organization is going to have to take on. Well, a lot of organizations have increased unused space right now, and will likely have that going forward until their leases run out or they sell real estate off. Could you actually lease that out to a childcare provider, thus providing on-site childcare that you're not paying for, because your employees are actually still willing to pay for the childcare? It just makes it a lot more convenient if I can drop my kid off on floor 1 and then I go up to floor 5.
Yeah.
And then you also get the revenue from the lease.
Exactly.
So
Right.
it's actually can be really positive.
Yeah.
And I mean, these are all consistent with, like, we did an employee survey. How are you feeling about your benefits? Have you, experienced, a barrier in terms of being able to afford your care? Those are the sorts of things that have been really helpful as we coordinate with our benefits team to figure out where can we improve and refine what we're offering employees. But we talk to a lot of employers too. We talk to a lot of, people who are working in this space. And one of my favorite examples is there's an airport in Texas. And what they found was it's located, redlining, et cetera, but it's located in a part of the city where the only food options are food swampy. So your fast food options and such. And they were looking at their healthcare spend, they were looking at their employees' health outcomes, and decided to co-locate a farmer's market, because one of the things that they learned when they did a focus group with their employees is that they don't have access to healthy food, and they don't have time to go and buy fresh fruits and vegetables. And so when they co-located this farmer's market, I think it was like 3 times a week, they started seeing demonstrable improvements in their burden of chronic diseases. And that's just something that, it's an airport. I'm sure they have one part where it might have been a little tight those 3 days a week, but for whatever it was, it met the need. The employees were happy, probably really helped to reinforce the local farmer community, et cetera. But it was just one of those sort of practical things that was creative, but also pretty obvious if you just kind of take a time to think about solving an issue.
Yeah. And what's interesting, I'm sure you guys have all seen the data that return to work is not something we talk about, but return to office being really disproportionately affecting women and minorities. And I will say one of the things that I did and my team didn't sort of manage particularly well in our first generation pre-pandemic was really understand how that impacted our team. Because we had some people on the phone supporting patients, and we had some people in more corporate roles. And what we learned was that transportation was so expensive for a lot of our employees And I hadn't even realized that there was like a state program and a state subsidy that all we had to do was register for, and it would make lower cost public transportation options available to our team. And so I think, Bonnie, you saying you really need to start with listening. No employee is, I think, going to expect you to pay for their lift to the office, but like making sure that you're really understanding what are those pain points and then doing the ecosystem deep dive of what's available. I think one of the things that we continue to be impressed by is there are a lot of resources that are just very, very untapped.
And on that, like with the return to office, right? So no, the employee doesn't expect you to pay for their Lyft or their Uber into the office, but they expect that there is a reason that they need to come into the office, especially if they have been effective in their role remotely for the past 2 years. So if you are just adding an extra expense to their life because you kind of think it might be helpful and you're more comfortable leading and managing in an in-person environment, that's not resonating with employees.
Yeah.
And so you've got to go beyond that to the nuance of why am I bringing people back in? And by the way, culture is not actually a reason to bring people in, because if all it took was to be in person to have strong cultures, 2019 would have been a year of the culture. And guess what? We had a lot of toxic cultures in 2019. Yeah. So you need to think beyond that. Think about the activities, think about what purposeful presence really means so that you can justify in a real way that gets buy-in from your employees why they're coming back into the office and why they're then spending the money to, take public transport or get in and the time.
Yeah. Yeah.
I mean, so I will say, Ashley, I have just over the course of this call, heard some great examples that you've brought up in terms of free benefits that exist out there as long as you know about them. And what's in my head is just, how do you make sure you know about all of these, right? Like, because I think it's great to listen to employees, make sure that when we're bringing them into the office, as Bonnie is saying, like they actually need to be in the office given the work that they're doing. But then there's also just other opportunities that we have. And I have a limited team. And it almost feels like I'm like, go find out everything that there is. But I think this is where I think at least it would be helpful to make sure people understand Wellist and the support that you can provide.
Yeah, thanks. And we didn't start here, right? Like what's very interesting is it took us almost a decade working with patients to be able to navigate by age, by the needs of a pregnant person is different than somebody who's getting knee surgery, is different than somebody who's managing a cancer experience, right? And it varies by zip code. And so I don't know that if we had started in the employer space that we would have really thought about that community building aspect as being core to well-being. But I think as we started this conversation, the unique mental health and burnout challenges of the pandemic have made those experiences very similar to what we saw supporting health systems. And what we learned was there's just a lot of resources buried. The question is, how do you surface that? Orriel, in our conversations, I think the thing that you've convinced me is most valuable that we can provide is actually to some extent giving employees the ability to self-select, not just in a survey, but going through and saying, these are the things that I need, and then matching them to those resources and seeing how they behave versus us assuming that we know. And I think that as we're moving into the employer space, that's really our core design principle based on our conversations with JP Morgan and others. But
yeah, it's not unlike what is very central to health equity, which is basically, they call it concordance. And I think that it's sort of this sort of cultural intentionality that I've heard someone coin it as more recently. And I really like that phrasing more than competency, because that kind of suggests just the bare minimum. But if you are intentional with how you're allowing employees to self-select, it's kind of inherent, right? That there will be, a good fit, and that if there's a good fit, they're more likely to use it. It's more likely to meet the need and get them where you intended for this benefit or for this value add to be. And even just personally, when I think through the benefit structure, it also gives you the ability to tailor to people who make different life choices. Because you noted earlier how family planning is different for people who are on different walks of life, but also it's different if you are single, right? And the things in the benefit structure are so sort of built around the concept of family and pairs, but sometimes being able to sit with a resource like what Wellist is putting together and say, these are the things that single me needs. Those are also, I think, things that we have to think more through, particularly as some of the data shows that there is an increase in people who are solo, and that will continue to increase over time.
Well, I have to say, obviously, we've made a bet with our business that this is a meaningful problem to solve. But I have to just comment, the reason why I think I personally, but I think the world is paying attention to this now is because of the great work that you guys have done to really frame and sort of call to attention the need for resources and solutions in this space. So thank you, Bonnie, for working with big companies to like help them put their head around what is the challenge and what do we need to do, and Orriel for your work and helping us get solutions to those problems and doing those in a way that's more equitable. And Andrea, you're amazing what you're doing on the ground sort of every day, helping these employees, and then sharing your learnings and best practices is just invaluable. So I literally owe a lot of my journey to each of you as we're trying to understand how we can have impact. But I hope that others who have listened to this webinar are equally inspired that this is a unique moment and we all need to work together to be able to put solutions around, I would say, employees. But before we get off, I also want to say the HR teams who have managed the last 4 years are exceptional, and I think have taken the brunt of it on all sides. And the degree to which we as a community can wrap our support around them and celebrate them, I think is really, really important, because it's easy to sort of turn our attention to the next thing, especially I think as financial pressures on businesses are getting harder. But I think without these amazing teams, we would have broken as organizations, as individuals. And so I think we need to, everyone who's attending, everyone on the panel, and I think everyone who's yet to come, there's a lot of community and bridge building that we can do to tackle these problems in the next couple of years and support these teams as we continue to take this journey together. So everyone, thank you, thank you, thank you. Any final words from the panelists? Otherwise, I will let you get back to your happy Fridays and wish you all a very restful weekend with lots of time and loved ones. So great.
I think the only thing I would say is take it one step at a time, right? It's how do you eat an elephant one bite at a time? And so I think that's what we're all doing with this, and we'll get there.
I totally agree. Ladies, thank you so much. Everybody who joined, thanks for joining us, and we'll be back with you soon. Take care.
Thank
Happy
you.
weekend.
Bye.
Bye.